Welcome to EnVision Center News, where we discuss community impact and involvement with today's nonprofit leaders and philanthropists. I am here today with Hope Health, and I have Ray and Lorraine and Brett here, and we're going to just discuss a new clinic that's coming to Sandpoint. And we're going to start by talking about the mission and vision. I don't know which one of you want to jump in, but the mic is yours.
Sure. And in starting out with some background, we really wanted to hit 4 objectives in starting this clinic. One is accessibility. It's tough to get into a doctor here. People generally will wait up to 3 to 6 months or longer to get into a physician. Even if you have a physician, it may take a long time to get into that physician. So we wanted healthcare that was accessible, where people could get same day or next day appointments and have access to their doctor with telemedicine using a process of direct primary care. The other thing we want it to be is independent of mandates, where people make informed decisions about their health care. And they can know the pros and cons of treatments and make those decisions for themselves. We want it to be affordable. So this is something that does not require health insurance. So it's unlimited care for a flat fee each month. Doesn't matter how much or how little you come in. It's just a flat fee, access to high quality doctors to get great health care. So those are some of the premises that we started with. And direct primary care is something that's booming throughout the country. And we want to do a take on it that really resonates with people of North Idaho and the needs of North Idaho.
Fantastic. What a blessing that this is coming here. Do you want to expand a little bit on that, Ray?
Yeah, and I think, and a big emphasis is it is going to be very ministry focused, where we're going to be really we will be sharing the gospel. We will be praying with our patients. We will be offering biblical counseling. So that's an important part to Hope Health. And I think just reminding people that there is hope in the Lord. Mm-hmm. The Lord uses us as physicians, but He's the one that ultimately does the cure. Yeah. And so that's what we want to really tap into Him.
Yes. Mm-hmm. All 3 of you guys are MDs, right?
Yes.
So you're coming. Are you all retired and picking up the torch again, or what? How did that work out? What's your guys' paths?
Well, I think we all come from somewhat of a retired path in the medical field. I retired years ago when I had children, and that became my primary ministry and goal and objective, and stayed active within the medical field, primarily through missions and community outreach and community projects, and obviously active with my continuing medical educations and maintained my licensing. And then when we moved here, it was very obvious that the need was here, and although we identify as physicians, our identity really comes from who we are in Christ, and we know that this was going to be a great opportunity for us to blend those 2 aspects of who we are. And we met Ray and Laura, and his beautiful wife is really critical